Hello and welcome. Today we're going to be talking about living with low vision and how to maximize our independence as we lose some of that ability to see everything around us clearly. So this presentation is going to go over a bunch of the common eye disorders that we see related to aging. And some strategies to help, again, maximize your independence. So when we talk about low vision, what do we mean? So everyone's vision can change with age. Some vision changes make it difficult to perform our everyday activities and can impact our feelings of independence and being able to care for ourselves. But that doesn't mean that these changes should stop us from learning ways to manage and compensate for these vision changes. Okay, so what is low vision? Low vision refers to changes in your vision that cannot be corrected simply with glasses or lenses. So some of the symptoms can include overall blurred vision caused by diabetic retinopathy, corneal scars, or cataracts. And again, some of those things can be addressed surgically or with medication, with better management of our blood sugars, with diabetes, things like that. Loss of central, or right in the center, vision caused by macular degeneration. That's the most common cause of that central vision deficit. Loss of your peripheral or side vision, and that is most often caused by either glaucoma or stroke. So who is affected by low vision? How common is this issue? Low vision affects 3.3 million Americans age 40 and over, which is 1 in 28 Americans over the age of 40. This figure is projected to reach 5.5 million by the year 2020. Okay, so obviously this slide is a little outdated, right? So we can say confidently that it's more than 3.3 million today, but I don't have an updated number. A study by the NIH reports that low vision and blindness increase significantly with age, particularly in people over 65. Okay, so we're going to talk about some age-related vision changes. Some common vision changes can include losing focus, noticing a decline in the sensitivity of our vision, and needing more light to be able to see things. With age, there's a higher risk of developing certain age-related eye conditions, such as macular degeneration, diabetic retinopathy, and glaucoma. Just as our physical strength decreases with age, our eyes also exhibit an age-related decline in performance, particularly as we reach our 60s and beyond. Some age-related changes, such as presbyopia, are perfectly normal and don't signify any sort of disease process. So, what is presbyopia? The inability to focus on objects that are up close. This is a perfectly normal loss of focusing ability due to a hardening of the lens of the eye, of the inside of your eye. As you continue to age through your 50s and beyond, presbyopia becomes more advanced. So that's a normal age-related vision change. You may notice that the need for more frequent changes in your eyeglasses or contact lens prescriptions can take place, and then you may also find that a single prescription is no longer the best solution for all of your visual needs. Wearing glasses with multifocal lenses, which can often be recommended as we get older, may increase the risk of falls among older adults because the near vision segment of the lens impairs the ability to see your feet clearly without first lowering your head, right? So that's going to affect being able to see where your feet are and what obstacles are close to your feet. But then the other part of that is that this also affects our peripheral vision and our sense of depth perception, so that when you're wearing glasses, your peripheral vision is not covered by those lenses. And that can additionally throw off your depth perception to be able to see where obstacles are, how close they are to you. Another example of an age-related vision change is cataracts. According to Mayo Clinic, about half of all 65-year-old Americans have some degree of cataract formation in their eyes. As you enter your 70s, the percentage is even higher. It is estimated that by 2020, more than 30 million Americans will have cataracts. So how does aging affect other structures within our eyes? While normally we think of aging as it relates to conditions such as presbyopia and cataracts, more subtle changes in our vision and eye structures also take place as we grow older. Some examples include reduced pupil size, dry eyes, loss of peripheral vision, and decrease in color vision. So let's talk about some of these in a little more detail. Reduced pupil size. As we age, the muscles that control our pupil size and reaction to light lose some of their strength. They're muscles, right? Just like the muscles in the rest of our body. This can cause the pupil to become smaller and less responsive to changes in ambient lighting. So we all know when the doctor moves that lighted pen in front of our eyes and they watch for the change in our pupil size. As we age, a normal age-related change is that we become less sensitive to that change and less able to make that change in our pupil size, which happens to allow for better vision in different levels of light. Because of these changes, people in their 60s need 3 times more ambient light for comfortable reading than those in their 20s. So you may notice that you're having to keep the lamp a little bit closer when you're reading. That is a normal change as we age. Dry eyes. I know this is one that a lot of people complain about. As we age, our bodies produce fewer tears. This is particularly true for women after menopause. Some of those hormonal changes that happen in our bodies contribute to us producing less tears. If you begin to experience burning, stinging, or other eye discomfort related to dry eyes, the use of artificial tears as needed throughout the day can help with comfort. Or you may need to consult your doctor for other options such as prescription eye drops or prescription eye medication if the over-the-counter stuff isn't working. Okay. There's also a normal loss of some of that peripheral vision. So with the size of our visual field decreasing by approximately 1 to 3 degrees per decade of life. So that means things kind of close in so that our vision is a lot better centrally and not as good peripherally. By the time you reach your 70s and 80s, you may have a peripheral visual field loss of 20 to 30 degrees. Decreased color vision. So the cells in the retina that are responsible for normal color vision decline in sensitivity as we age. This causes colors to become less bright and the contrast between different colors to be less noticeable. In particular, blue colors may appear faded or kind of look washed out. Okay, so a very common condition of the eye called macular degeneration, or also called age-related macular degeneration, is the leading cause of blindness among American seniors. According to the National Eye Institute, macular degeneration affects more than 1.75 million people in the United States. The U.S. population is aging rapidly, as we all know, and this number will increase to almost 3 million by 2020. Some symptoms of age-related macular degeneration. There's typically not pain, but you do have blurred vision, drusen, which is yellow-white cellular material that builds up in the eye, but that can only be seen by an eye care professional using equipment. Some treatment options for macular degeneration. Age-related eye disease study special vitamins and minerals supplement formulation. So there's all kinds of eye supplements that are out there, and that's a specific one. Laser surgery, eye injections, and photodynamic therapy. So all of those are things that you would need to discuss with your eye care professional. So if we look at what type of vision loss we typically see with macular degeneration, it's a loss of central vision. So often people will describe it as feeling like there's a hole in the center of their visual field. So if we can see this picture here with the two little kids, and they're each holding a ball. On the top there, that's normal vision. On the bottom and center there, that's an example of visual loss that we see with macular degeneration. So you can see there is kind of a hole in the center of that vision there, and you cannot see the children's faces. Okay, another common condition is glaucoma. Your risk of developing glaucoma increases with each decade after age 40, from around 1% in your 40s to up to 12% in your 80s. The number of Americans with glaucoma will increase by 50% to 3.6 million by 2020. So, symptoms of glaucoma. There's not typically any early warning signs or symptoms, and there's not typically any pain, but we do have a loss of side vision. Some treatment options can include medications, usually eye drops, and sometimes laser or conventional surgery. So what does that loss of our side or peripheral vision look like for somebody with glaucoma? So again, you see that normal vision picture of those kids. And then if we look at that picture on the bottom, you can see how there's some darkness closing in on the edges of that picture. Okay, another common condition is diabetic retinopathy. So obviously, this occurs in someone who has diabetes, and it's more common in people who have long-standing, uncontrolled or not well-controlled diabetes, so where their blood sugar is kind of all over the place and not well managed. Among known diabetics over the age of 40, NEI estimates that 40% have some degree of diabetic retinopathy, and 1 of every 12 people with diabetes in this age group has advanced vision-threatening retinopathy. So the eyes are one of the early places that we see diabetic changes. And the reason for that is the very tiny blood vessels in the eye. Those are the very tiny blood vessels are the ones that are affected most and first in diabetic conditions. So that is why we see the eye, and then oftentimes we'll see the hands and feet. We'll see diabetic neuropathy there first as well. So it's because of those smaller blood vessels in those places. Okay, so there are no early warning signs or symptoms of diabetic retinopathy, and early detection and timely treatment can reduce the risk of vision loss. Some treatment options include laser treatment and surgery. So what does that loss of vision from diabetic retinopathy typically look like? It's a loss of random vision, so it can look kind of like holes in your vision. So again, we see this picture with the kids at the top, and then the same picture is down at the bottom, but those black spots are holes in the vision. And again, that's just an example of a possible way that that could present. So now we're going to focus on low vision rehab. What do we do about these vision conditions? Participation in a specialized rehabilitation program can help to develop a visual modification plan to ensure safety and independence. Because we do know that with these vision changes, they're progressive, right? So the vision that you have today is not going to be the same as in 6 months or a year from now. So if we have more vision now and we can do things to better modify our environment and make a plan for when that vision gets worse, then we're going to have ourselves set up for success later on. Some recommendations may include adaptations to the environment, modifications of your daily routine, the use of visual aids and adaptive equipment, and orientation and mobility skills training. Okay, so there's a handout that I provided that goes over the 6 main principles of low vision rehab, and that will be available also in the activities department. So number 1 is to increase task illumination. So as we age, like we talked about, we require 3 times as much light as a 20-year-old. Number 2 is decreasing glare from lighting windows in the sun. So it's not always better to just have more light. We have to have it appropriately placed so that it doesn't increase glare. Modify the size of the objects with either large print versions of the product or with special magnification products. Enhance the contrast between the object and its surrounding. Modify the approach to task to ensure safe and effective follow-through. And develop or enhance orientation and mobility in a variety of situations. Okay, so that first area, lighting. Lighting is an important consideration for individuals who have low vision. Consider the everyday activities you perform in each room of your home, and then decide if you need additional or different lighting in each space. Your lighting needs will be different depending on the task that you're performing. Additional lighting considerations. It is not recommended that you create additional illumination by simply placing a higher wattage bulb in an existing light fixture or lamp. Putting a high wattage bulb into a ceiling fixture will not necessarily produce better, more functional light. Instead, it could increase glare and create more shadows that are also deeper. A therapist can help you evaluate the different types and light sources within your home, and they can also help you identify if glare is impacting your vision and help you figure out what to do about it. Modifying the size of print or objects. As we age, to some degree, low vision may be inevitable. This is because aging itself leads to slow degeneration of the light-sensitive cells in your retina where vision processing occurs. Modifying the size of objects with either large print products or the use of optical devices such as magnifiers or readers can help you to preserve more functional sight. There are many types of optical devices. We recommend starting with one device to see how you manage and adding additional devices as you become proficient with the device. Having a whole bunch of different devices to help you isn't really going to help if you don't use them frequently and know the best ways to use them. If it's just going to sit on the shelf, it's not going to be helpful for you, right? It is extremely helpful to both you and your therapist if you can make a list of the tasks that are most important to you to help determine what devices may be most helpful. Any low vision service is incomplete unless you've been taught how to use the device. An occupational therapist can help you to become proficient with this process. So another area is enhancing the contrast. Use of different colors can be helpful to enhance independence, safety, and accessibility. Color can also provide important safety cues. An indicator of change in surfaces or levels, such as ramps or stairs, is a good example. Sometimes you'll see those big strips, either dark strips on a light surface, or bright yellow strips on a darker surface, right? That's super helpful to see that contrast and know that there's a change in the surface. A warning for potential hazards such as doors or cabinets that have been left ajar. So being able to see the contrast between that door or cabinet and the surface around it and the color. If you can't see that change in color, you're more likely to walk into it, right? Keep the following color principles in mind to enhance independence. Bright colors are generally the easiest to see because of their ability to reflect light. Solid, bright colors, such as red, orange, and yellow, are usually more visible than pastel colors. So contrast sensitivity, again, this is a really good example, these red and yellow blocks down there. You can clearly see that purple outline is visible in those colors because there's good contrast between them, right? Contrast sensitivity refers to the ability to detect differences between light and dark areas. Increasing the contrast between an object and its background will generally make the object more visible. Keep the following contrast principles in mind. White or yellow print against a black background usually provide the strongest color contrast, as you can see in those color charts there. Using solid colors as backgrounds to make objects stand out can be helpful. Avoid the use of patterns, prints, or stripes as they're going to detract from the writing and make it harder for you to see contrast. Modifying tasks. There are many strategies for maximizing your independence, and rehab can assist in helping to identify the means for modifying the actual task or your approach to completing the task. The main objectives in approaching any task include the following. We want to eliminate clutter. We want to return all equipment or supplies to the appropriate storage when we're finished using them. And we want to use our other senses to help identify and locate items as well. Orientation and mobility training. Therapists can assist in identifying the need for specific mobility devices and the specific strategies to incorporate in order to maximize your safe mobility for around your home and within the community. So again, like we talked about, if we're not using those devices appropriately, they're not going to be any good, but your therapist can help you with that. All right, so we're going to sum things up a little bit here. Participation in a specialized low vision rehabilitation program can help to develop a visual modification plan to ensure safety and independence. Recommendations may include adaptations of the environment, modifications of daily routine, the use of visual aids and adaptive equipment, orientation and mobility skills training. Individuals with low vision can make the most of what vision they do have. It pays to be proactive and learn about low vision rehabilitation services sooner rather than later, so we have more to work with. Low vision does not need to be a debilitating condition. and daily routines and environments can be modified to compensate for low vision. Thank you so much.